Welcome to the Explainer. So, right up on screen, you'll see a pretty academic-sounding title, Advanced Clinical Perspectives on Aged Black Garlic for Cardiovascular Health. I know it's a mouthful, but we are absolutely going to unpack the fascinating biochemical transformation of an ancient botanical into a highly targeted, standardized cardiovascular therapy. We're separating the hype from the actual, evidence-based science today, so let's get right to it.
Here's our roadmap for today. We're going to hit atherosclerosis and allium-cysteine, then look at biochemical reconfiguration via aging, mechanisms of cardiovascular protection, clinical evidence of plaque regression, the advanced glycation paradox, and finally, clinical modalities and administration. Make sure to keep an eye on the text labels as we go, because it'll really help anchor these complex concepts. Okay, kicking things off with Section 1, atherosclerosis and allium-cysteine. First, we've got to establish the exact baseline pathology we're actually trying to treat here.
You know, atherosclerosis really isn't just a simple plumbing problem of clogged pipes. It's actually a complex, lipid-driven inflammatory disease. It literally starts with a breach in your blood vessel walls, which we call endothelial dysfunction, and then it just accelerates through oxidized LDL cholesterol. Before you know it, the whole thing snowballs as your immune system sends in macrophages that get stuck trying to clean up the mess. Now, traditional raw garlic has been used historically for its cardioprotective properties, but honestly, its clinical utility today is kind of limited by gastrointestinal distress and the severe volatility of its primary active compound, allicin.
That brings us to Section 2, biochemical reconfiguration via aging. Let's look at this thermal reconfiguration process.
So what happens when you age garlic? Well, thermal processing kicks off the Maillard reaction. That's the exact same browning process that gives a seared steak its rich flavor. But here, over weeks of high heat and humidity, it totally strips away that pungent, volatile allicin you find in raw garlic. And what it creates is an entirely new, stable therapeutic profile. By basically baking the raw garlic at temps between 60 and 90 degrees Celsius, the allinase enzyme gets deactivated. The irritating allicin degrades entirely. What emerges is this soft, black, umami-rich compound packed with deeply bioavailable, stable organosulfur components.
Now, if there's one crucial biomarker I need you to remember today, it's SAC, S-allyl-cysteine. Lock that acronym in. Because SAC's predictable absorption kinetics, meaning how reliably it gets absorbed and how steadily it hangs out in your bloodstream, that's exactly what drives the clinical outcomes we're going to explore. See, unlike lipid-soluble botanicals that need dietary fat to absorb, SAC is inherently water-soluble. It absorbs super efficiently in the human GI tract. That allows it to hit sustained plasma concentrations that literally exert continuous pharmacological pressure on cardiovascular disease. It's a game changer.
Let's move right into Section 3, mechanisms of cardiovascular protection. This is where we see a multi-targeted defense happening right at the molecular level.
Here is a step-by-step look at the atherogenic cascade, which maps exactly where SAC steps in to help. Step 1. It acts like a massive roadblock, aggressively suppressing the liver synthesis of LDL cholesterol by inhibiting HMG-CoA reductase. Step 2. It upregulates macrophage ABCA1 transporters. Think of these like cellular garbage trucks. They pump excess cholesterol out of immune cells before they can turn toxic. And Step 3. It restores nitric oxide. That nitric oxide basically acts like Teflon in your blood vessels, completely preventing inflammatory monocytes from sticking to the vascular walls.
What's absolutely fascinating here is the sheer biochemical pressure SAC puts on the exact same hepatic cholesterol pathway that prescription statins target. I mean, in vitro evaluations show a massive 30 to 40% suppression of HMG-CoA reductase enzymatic activity. That's huge. And in human clinical evaluations of patients with high cholesterol, these standardized extracts have drastically improved the HDL to LDL ratio. We're talking sometimes by upwards of 70%. It creates a systemic lipid environment in the body that's just highly resistant to new plaque formation.
All right, moving on to Section 4, clinical evidence of plaque regression. Let's look at the actual human clinical data.
Researchers looked at a massive daily dose of 2,400 milligrams of aged garlic extract over a one-year period, and the angiographic tracking data they got was incredibly compelling. But actually, let me be very specific here. The strongest human evidence for slowing coronary plaque progression relies specifically on standardized aged garlic extract. You'll often see it abbreviated as AGExt. This is distinctly different from the generic black garlic you might just toss into a stir-fry.
Now take a look at these numbers. This data shows that standardized prolonged exposure can actually induce a volumetric regression in the disease. Using cardiac computed tomography angiography, researchers tracked metabolic syndrome patients over an entire year. The placebo group suffered a really devastating 57% progression in low attenuation plaque. And remember, that's the highly vulnerable lipid-rich soft plaque that's most prone to rupturing and causing a sudden cardiac event. But the group taking the 2,400 milligrams of AGExt, they saw an absolute regression, a 29% reduction in that exact same dangerous plaque volume. Really remarkable stuff.
Section 5, the advanced glycation paradox. We need to distinguish the therapeutic benefits from the dietary hazards here.
Okay, there's a major terminology trap in the medical literature we have to clear up. We need to strictly separate the therapeutic supplement, AGExt, from potentially harmful dietary components called DAGs. In cardiovascular literature, AGE stands for aged garlic extract, but in nutritional science, it stands for dietary advanced glycation end products. Because black garlic goes through such high heat during processing, it inevitably forms some of these dietary glycation products, like 5-HMF, right alongside the good stuff. And here is the ultimate biological paradox. Yes, thermal processing generates dietary advanced glycation end products, but the specific molecular sulfur in black garlic, like our old friend SAC, actually acts as an incredibly potent endogenous AG inhibitor. It's wild. SAC basically aggressively binds to and neutralizes early-stage glycation products inside your body, stopping the cascade before irreversible cellular cross-linking can happen. So when the extract is manufactured right, this massive internal physiological shield easily overpowers the localized hazards. The result is a really robust, net positive biological equilibrium.
Which brings us to our final section, Section 6, Clinical Modalities and Administration. Let's talk about guidelines.
So, when you're translating all this data into your own vascular goals, the intervention vehicle you choose matters immensely. As you can see, for general dietary prophylaxis, just eating up to 12 grams or about 4 cloves of whole black garlic a day is totally fine. But if your target is hemodynamic and blood pressure regulation, you'll want a standardized ABG extract at about 250 milligrams, which yields around 0.25 to 1.25 milligrams of SA. However, if you are actively trying to target structural plaque regression, the clinical evidence points strictly to that high-dose, 2,400 milligrams standardized aged garlic extract.
Now, as an impartial reporter of this data, I absolutely have to emphasize that these botanical extracts are powerful clinical adjuncts. They are not replacements for standard medical therapies. Do not go tossing out your statins or antihypertensives. Also, because these compounds can have antiplatelet effects, you've got to use caution if you're on blood thinners like warfarin. And one last thing, while making black garlic at home might sound like a fun weekend project, you should really avoid uncontrolled homemade batches. There's a serious risk of foodborne illness when you're working with warm, moist, low-oxygen environments, not to mention you'd have completely variable active compounds.
The key takeaway here really comes down to objectivity. As the quote notes, the safest and most evidence-consistent framing is that black garlic and ABG may support cardiovascular risk factor management, but they are adjuncts, not guaranteed plaque removal therapies. The data is incredibly promising, and the biochemical mechanisms are rock solid, for sure. But we have to frame these extracts appropriately. When standardized properly to SAC, they're phenomenal tools, but they're part of a broader management toolkit.
So I'll leave you with this final thought. As the global burden of metabolic disease relentlessly escalates, how will we continue to seamlessly bridge the gap between functional nutritional biochemistry and advanced pharmacological vascular care? Think about it. Botanicals, once used just for cooking, are now providing measurable, angiographically verified defense against our leading killer. It's a prime example of ancient wisdom meeting modern clinical precision. Thanks for joining me for this explainer, and definitely keep exploring the incredible world of clinical biochemistry.